Yours? Is this yours? Is this yours? No? I don't know. Whose phone?
They're just being recording the message.
Oh, fine. Oh, sorry. Okay. All right, thank you all for being here on short notice. A few days ago, we came together to share how the city has been preparing for the likelihood of having a positive case of COVID-19. Today, we received that confirmation, and we're here to provide an update on the city's response. Under the leadership of our Health Commissioner and Managing Director, in partnership with the Commonwealth, SEPTA, the airport, hospitality industry, and many other stakeholders, we've been preparing for weeks. And I want to assure the public that Philadelphia is ready to manage the situation with the urgency that is warranted. Frankly, we are fortunate we did not have a case sooner and that we've had adequate time to prepare so we can mitigate the impact locally and keep more Philadelphians well. We're going to turn it over now to our public health and emergency management experts. I'd like to introduce Managing Director Brian Abernathy, who is overseeing this effort for the city.
Thank you, and thank you for coming today. COVID-19 has been spreading across the globe, and today, as we expected and planned for, has reached Philadelphia. I can confirm that the Health Department, in consultation with the State Health Department and CDC, have confirmed that Philadelphia has a case of the coronavirus. As Dr. Farley will explain, patient confidentiality rules strictly limit what we're able to say about this case. I know you have more questions, but what Dr. Farley says about the specific individual is limited to what he's about to tell you. Dr. Farley?
Thank you all for coming. As you have heard, we do have the first recognized case of the COVID-19 coronavirus infection in a person who resides in the city of Philadelphia. I can tell you this patient is receiving treatment, is at home, and that this patient was exposed to another person who was believed to have COVID-19. The Philadelphia Department of Health is going to reach out to the people that this patient exposed, and this patient was in contact with other people that may have been exposed, and we will quarantine those people who were exposed to that person. Now, this is the first case that has occurred in a Philadelphia resident. However, we do know that there are several cases that have occurred in metropolitan Philadelphia, at least one of which is in a person who had no known exposure to another person with COVID-19. Most of all, at least one of which had exposure to someone who did not have known exposure. That means that the virus is circulating in Philadelphia now. Now, we expected this, but this does mean that the pandemic has now arrived to the city of Philadelphia. So the city is responding as quickly as it can to the situation. There are two areas I want to re-emphasize that we are focusing on. One is case containment, the other is reducing citywide spread. Case containment has four parts to it that we were going to be working on. First is rapid case identification. The sooner that we can identify people who have this infection, the more quickly we can put in place the rest of these steps. The second is case isolation, so that these people do not pass the infection on to other people after they are identified. The third is contact tracing. That is identifying those people who may have been exposed before the case was initially diagnosed. And the fourth is contact quarantine, taking those people who have been exposed and keeping them apart from other people so that if they develop these symptoms, we have ended the chain of transmission. Now, the health department will be taking the lead in the second, third, and fourth of those steps. But the rapid case identification does require support. It requires people in the public recognizing those symptoms, bringing themselves to attention of physicians if they have those symptoms, and physicians testing those people. Now, we know that testing is available. Not as widely available as we would like it to be, but it is improving day by day. And we want to encourage people who have symptoms of this to contact their physician so that we can identify cases rapidly. And I'll come back to that in a minute. The second part of this is reducing community-wide spread. That includes limiting large public gatherings and other social distancing measures meant to reduce the likelihood that this infection will spread from one person to another. Now, all of the heavily affected areas have implemented actions like that. And here in Philadelphia, we expect the number of cases right now is small, but we want to keep it that way. And so we want to be ahead of the curve here and move as quickly as possible to try to reduce that spread. So we are making recommendations today based on the information we have today. The greatest risk is if there's a large number of people who are in contact closely with each other, large public gatherings. So as of today, we are recommending that people in Philadelphia not attend public gatherings that would typically have more than 5,000 people at it. Okay, we are not canceling those gatherings, but we are recommending that people not attend those public gatherings. This is especially important for people who are vulnerable to this infection. That would be the elderly and people with chronic illnesses. That includes sporting events, other large events like that. It includes the parade that is scheduled for this weekend. We are not canceling these events. We are not prohibiting people from going there, but we are recommending that people not attend as spectators. Instead, we are recommending that people watch those events on television. And as far as the parade specifically, we are not canceling the parade because the marchers themselves have enough distance from each other, and there's not so many of them that there's not a large crowd amongst them. And again, likewise, any public gathering of more than 5,000 people, we are recommending that people not attend in person. Now, these recommendations may change as we see how effective our strategy is. And this is a rapidly changing situation, so people should pay attention. Our recommendations will change with that. What do Philadelphia residents need to know now? Most important, the two most common symptoms of the coronavirus infection are fever and a dry cough. If you have those, stay away from other people. If you have a fever and a dry cough, stay away from other people. If you have those and you have been suspected to have an exposure to someone else who has this infection, call your physician to be tested. Okay? That's the information we have here today. I'd be happy to answer questions, but first I want to turn it back to Managing Director Brian Abernathy.
Thank you, Dr. Farley. Next, our Fire Commissioner and Director of Emergency Management, Adam Teal, has word of our planning and preparedness.
Good afternoon. The Office of Emergency Management is supporting the Department of Public Health and city continuity of operations across the entire enterprise. We are planning to activate our Emergency Operations Center, a limited activation, tomorrow at noon, and we will be having our first unified command call later this evening. In addition to the website you heard earlier and our Ready Philadelphia system, the city is using a special system to share information about COVID-19 through free text alerts. You can text the keyword COVIDPHL to 888-777 to receive info and updates through Ready Philadelphia, our city's mass communication system. Again, that's COVIDPHL, COVIDPHL. Text that to 888-777.
Thank you. I do want to take an opportunity to say thank you to our operating departments who have been working tirelessly to prepare for this event, as well as our Human Resources Department and Chief Administrative Officer, as well as the school district and all of our partner agencies with our teams, the Convention Visitors Bureau, and certainly our conventions. And finally, I want to thank City Council and give Council President Clark an opportunity to address.
Thank you. Thank you very much. Thank all of you. Just want to say that it's important for us to have the appropriate messaging. Members of City Council, while we are not a functioning operating department, it's important that we have the same messaging that our executive branch does. So we do that in terms of us making sure that whatever is needed, be it a budgetary or a legislative issue, council is fully prepared to support those initiatives. Clearly, we don't want a panic, but we are asking people to be cautious and follow the science. So I want to thank the mayor and his team so much for you all being on top of this and being proactive in terms of the eventuality that this reaches the city of Philadelphia. So thank you very much. Thank you.
Thank you, sir. The first presumptive confirmed case in Philadelphia raises a host of questions about how we go about our daily lives in Philadelphia. As you heard from Dr. Farley, we are now advising that Philadelphians consider not attending public gatherings with more than 5,000 expected attendees. Obviously, this is a difficult situation, and we certainly recognize that many businesses and individuals rely on these sorts of events for their livelihood. Today, in light of this development, I specifically reached out to the organizers of the St. Patrick's Day Parade and recommended that they urge supporters to stay home and watch on television. We make this recommendation with a heavy heart because we know how beloved that parade is for so many Philadelphians, recognize its 250th anniversary this year, and certainly recognize the hard work that all of its volunteers have put into it. But we also do so with an abundance of caution. This also impacts our sports teams, both professional, collegiate, and even high school. It is simply far more important at this point in time, and to keep our residents and visitors out of large crowds of that size. Again, this is an evolving situation. The health department is evaluating the need for precautions constantly, and the city will continue to provide guidance based on the evaluation of Dr. Farley, our emergency management, and the entire city team. It's happy to open the floor for questions at this point.
In interest of the confidentiality of the patient, really no more details than what I said before. This was an adult from the city of Philadelphia that was exposed to a known case. The person is being treated at home.
Was this diagnosed today or?
I can only tell you that we got the test result today, that the diagnosis may have been earlier. We're not recommending closing any Philadelphia schools. In general, this infection of children appear to be at low risk. I can say that this person did expose other people, and we will be we will contact those other people to make sure that they're quarantined. I can't tell you whether there are children amongst those who were exposed.
Have you already contacted the people who were in touch with the patient, or should they expect you to do this?
We have already started that process. I don't know if we've reached them all, so it's possible that some of them have not been reached yet. I can't tell you how many, no.
For Commissioner Teal, I have a question. New York City said that one of their EMS workers has been exposed. For the city of Philadelphia, what are you doing just for the paramedics and EMS and firefighters that might be responsible? Any different?
So I appreciate the question. We've been planning for this for weeks, frankly. So we have plans. Again, some of this, and again, consulting with Dr. Farley, who's the best in the business. We're fortunate to have him on our team. We're ready. There's still a lot of unknown unknowns, but we have contingency plans for operating with less staff than we expect normally. We have contingency plans potentially for. We want to make sure our providers are treated. We have potential to have to quarantine providers. So those are all things that we've been working on. And every city agency, this is the continuity of operations. Every city agency, regardless of what they do, has those same plans, and that's a lot of what we've been working on, we'll continue to work on. But again, you can imagine, as you think about the scope of city services, there's a lot of work that needs to continue. The daily work needs to continue regardless of this fact, and rest assured, all of that is happening. That's one reason we're activating the EOC tomorrow, because we're elevating that activity.
Yeah, so the city does have the authority, if it wanted to cancel such events. We don't see a need to do that right now. We think that the appropriate response is simply a recommendation, which we think most people will follow, and that will reduce the crowd sizes. As far as what we might do in the future, I can't say. If this gets worse, then we may be changing those recommendations and lowering the threshold, for example, of the size of those events. And we may, I can't say whether we could in the future actually require the closure, but we're certainly not there now.
The organizers were understanding of the city's position. Clearly, they are recognize that this is an important public health situation that we found ourselves in. We didn't make this request lightly, and they've been very responsive and respectful of the city's position. They are still planning to have the parade, but understand that we'd prefer folks not attend in person and watch on TV.
I don't have the details. I can say that there is always a certain amount of time between when someone develops symptoms and when they get a diagnosis and a test result. We want to shorten that time as much as possible. During that time, this person did expose other people, and so we're going to be finding those people and getting them in quarantine. Can you actually find them, or this person was just like grocery shopping or something? Well, experience from other countries says that the vast majority of the transmission occurs to people who are close household contacts. And so most of the contacts are going to be easy to find. We may not be able to find everyone, which is why we're also taking these steps to reduce community-wide spread, but we think we can find the majority of them. I can't tell you about it. There are many more opportunities to be exposed now than there were earlier because there are cases in countries around the world, there are cases all over the United States. I'm sorry, can you repeat the question? I can't respond about any individual hospital. I can tell you that we are working with all the hospital systems in Philadelphia and have for a long time. And we have an ongoing emergency planning relationship with all the hospitals in the city. And so that they're all prepared to deal with these cases if they were to come there. This is a presumptive positive. It was a positive test here. We will send confirmatory testing to the Centers for Disease Control, but we would think it's extremely likely that this will be confirmed, and so we're acting on that assumption. You know, at the end of each day, we update the number of people under investigation. It changes all the time. So, but at the end of today, you will get information about how many people we currently have under investigation. I do not have it right now. I do not recommend the closure of universities at this point, no. At the moment, we're not recommending that. We are recommending that all organizations look into that possibility should we make that recommendation in the future. But the number of people that someone is exposed to at work is a good bit smaller than at these large public gatherings. And so we're not there yet. It's just something for all organizations to think about, should we need to do that in the future.
And we are encouraging all of our private employers to relax their sick leave policies to be able to give every consideration to workers as we work through what this outbreak may or may not be.
I don't know exactly how CDC is defining community spread, but I would simply say that if we have cases with no recognized exposure, we have to assume that there are some cases that have not come to the attention of physicians. And so that triggers us to be more proactive in trying to prevent spread through actions like our recommendations on the public gatherings today. I can't say that it was not the case that was diagnosed in Philadelphia today, or that we are reporting today, but we now have some number of cases in the greater Philadelphia area. I don't have the exact number, but it's probably between 5 and 10, and I can tell you that not all of them had a known exposure. You know, I think the universities have all been very proactive and responsive already about this, and they're looking into distance learning and reducing travel among students, we are not recommending that they cancel large classes. That may happen at some point in the future. They need to plan for that, but I think the universities are very much on top of this. Yeah, so people who are sick and need clinical evaluation should go where they go for medical care under ordinary circumstances. If many of them go to an emergency room, an urgent care center, if they have a primary care physician or a clinic that they go to, they should go to those clinics. We do have sites where everyone can receive care in Philadelphia regardless of ability to pay. If they are sick with a fever but don't feel they need medical attention, they're not feeling terribly ill, then they should first stay away from other people. And then contact their doctor to see about getting in a test.
So we're considering a host of options. We recognize the intense and deep poverty in the city, and that treating and managing through that population is going to be more difficult than some of our colleagues. I don't have specific answers, but it is absolutely something that we are considering and have at front of mind as we move forward.
I believe so, yes.
Council?
None at this point, but there are certain provisions within the city code that could possibly be triggered if we reach a certain level. But at this point, there's not the discussion about that in any particular way.
Great, thank you all.